Morning. I'm Marty Fota. I'm Chief Operating Officer at United Neighborhood Centers. I'd like to welcome everyone here to beautiful Bucktown Center, which is our newest affordable housing development here in Dunmore for seniors 62 plus. I'd also like to, state that really safety and health is one of our key goals for our residents at all of our apartment buildings. And the importance of vaccinations is extremely important to us as property managers and property owners. And, we stress the importance of getting all of our tenants vaccinated, and there's still time to do that this year. And I'd like to kind of pass the torch here to Dr. Debra Bogen, the Pennsylvania Secretary of Health, to say more.
Great, thank you so much. Good morning and happy holidays. Thank you, Marty, for the introduction, and thank you to Secretary Kavulich and Director Boegen for being here with me, as well as MJ, who's one of the residents here. It's great to be at this really beautiful space at Bucktown Center. To start, I want to applaud the residents here. I heard that while we were preparing for this event, that you all had your own flu event in October with DePietro Pharmacy, and you all got vaccinated. So that's amazing. You're setting an amazing example for Pennsylvanians across the state. So the holiday season is here, as you have beautifully decorated here. And soon many of us will be gathering with our friends and our neighbors and our family to celebrate. And the holiday season really is about spreading joy, not about spreading germs, so we don't want you to do that during the holidays. So to protect yourselves, your friends, your family, your neighbors, we strongly encourage people to get their flu vaccine, if you haven't already done so, like all the people here have done. As you probably know, the flu vaccine reduces your risk of severe infection, hospitalization, and death, and it also reduces your chance of spreading the virus to other people. It is never too late to get your flu vaccine, and right now is the perfect time if you haven't already done so. That's because your body's immune system takes about 2 weeks to reach its peak protective antibody levels after you get the vaccine, and the holidays are about 2 weeks away. So, and the same goes not only for the flu vaccine, but for the COVID-19 vaccine, as well as the RSV vaccine. So, interestingly, this year, Pennsylvanians and others across the country have a new option for protection from flu. This year, the Food and Drug Administration approved the first at-home self-administered flu vaccine that comes as a nasal spray. Just like traditional vaccines you get in your doctor's office, it's safe and effective at preventing severe illness from influenza, from flu. And even though this is the first year that people can order the at-home intranasal flu vaccine, it has been used in doctors' offices for more than 2 decades. During my years as a pediatrician, I had more than a few needle-phobic averse children whose parents requested it, and so they could be protected against the virus without having an injection. And I personally got the intranasal flu vaccine for quite a few years. So now it's available through mail order through the pharmacies. So people who are interested in getting vaccinated for flu in this new way online can go online and fill out a screening and eligibility assessment. And if you're eligible, it will be shipped directly to your home. It's important to note that the at-home self-administered flu vaccine is only available for people 2 to 49 years of age. It eliminates a number of people in this room, including myself, which is why I no longer get the intranasal. But for all your children and grandchildren and all those other folks, your neighbors, remind them that that's an option. Besides getting vaccinated, it's also really important to get tested at the first signs of illness. And that's because there are medications your doctors can prescribe to reduce the risk of severe disease among people at high risk, particularly young children, older adults, and people with chronic lung disease, heart disease, or other medical conditions. As the Insurance Department Policy Director, Carolyn Boegen, will talk about in a few minutes, most insurance plans cover the flu vaccine without out-of-pocket cost. For people who are uninsured or underinsured, the flu vaccine is available through our 59 state health centers and at federally qualified health centers across the Commonwealth. And for children who qualify, the flu vaccine and other routine childhood immunizations are available at no cost through providers who participate in the Vaccine for Children's program. and a list of those providers can be found on the Department of Health's website. So I know that many of you here are grandparents, aunts, uncles, and you play an important role in protecting your loved ones from severe case of flu. Encourage your children, your grandchildren, friends, and neighbors to get their annual flu vaccine. And I say this because the flu is typically responsible for more hospitalizations. It's almost always, except during COVID, it is responsible for more hospitalizations and deaths in the US than any other vaccine-preventable disease. About 200,000 hospitalizations and thousands of deaths every year occur because of the flu. So before I wrap up, I want to take a moment to discuss vaccines in general. I'm sure you've all heard the conflicting narratives going on lately about vaccines. As a pediatrician, I practiced for 25 years, and a researcher, I'm here to tell you that the vaccines we have save lives and reduce suffering. And Pennsylvania's will continue to have access to them, and that is something that we are really committed to as an administration. Earlier this year, Governor Shapiro signed an executive order protecting access to vaccines and ensuring that residents have clear and fact-based information about them. If you have any questions about a given vaccine, please visit pa.gov/vaccines. So, speaking of vaccines, we are pleased to have pharmacist Tom DePietro from DePietro's Pharmacy here in case there is anyone who has not yet gotten their flu vaccine. He is here to administer vaccines to anyone who would like them. So again, thank you so much, Bucktown Center residents and staff, for setting a great example for the rest of Pennsylvania by being vaccinated against flu. And now it's my honor to invite Secretary of Aging Jason Kavulich to the podium to discuss the great work his agency is doing in this area.
Thank you. Good morning, everyone. Before we get started, I have to, go into full disclaimer that this, in fact, is not a Dunmore Bucks tie, as General Weigel would argue if she was here with us today, a proud Dunmore resident that she is. This is, in fact, a holiday tie, and thankfully Senator Flynn's office is here with us today to back me up on that. Being the true West Siders that we are, we want to make sure that we did not have that mistake made for our colleagues, for our community members. It's wonderful to be back with you all at Bucktown. Every time I drive by here, I think of the first time I think that's an ornament. Thanks, MJ. Good morning. So it's wonderful to be back here. Thinking of the first time I saw the blueprints with Marty and Lisa, how hopeful I was at the groundbreaking, and how proud I was of United Neighborhood Centers and the community the day that we cut the ribbon at this beautiful complex. Thank you once again for welcoming us back into your homes. Some of my friends from the community recall that I have some vaccine experience under my belt, but I'm not an expert. My friend Dr. Bogen is an expert. And as a member of a community, more than a member of the cabinet, I am grateful for her and the team of experts she works with to make sure we have all the information we need to make informed decisions regarding our own personal health. I am grateful for my friend and coworker Tom Sneddon, the director of our PACE pharmaceutical program. When Governor Shapiro issued his executive order on October 1st, to ensure Pennsylvanians retained access to safe and effective vaccines, Tom and our 52 area agencies on aging were already hard at work setting up vaccine clinics for older adults in locations they could easily access them. Senior centers, housing communities, and many other locations all have been used to make sure we're doing our part to give older adults what they want, access to safe and effective vaccines. In communities like Allentown, Nanticoke, Kingston, and Berks County, we will continue to work with partners like Wegmans and Weiss Markets to provide these clinics. I know all too well the importance of working with our academic partners, and I'm grateful to Wilkes University's Nesbitt School of Pharmacy for all the work they have done to help each of us and every older adult in Pennsylvania. Most importantly, we need to thank our local pharmacies. They are true community assets and stood with us, especially those of us living in this community, in the most challenging of times. Lackawanna County is always a leader, leads the charge in these efforts, thanks to the amazing work of community partners like Tom DePietro. Tom and his team are everywhere, helping older adults in this community, and we will do all that we can to support his work and show how much we truly appreciate and value his partnership. Ready or not, the holiday season is here, and many of us will be moving from one gathering to event and on to the next. This year, for the first time, many of the number of older adults we are seeing are showing vaccine hesitancy. It is your choice, but please do so based on reliable information from experts like the experts we have at the Department of Health and guidance from trusted community local partners like Tom DePietro. We want you to have a wonderful holiday season, and we need you to keep our community strong. Whether you are a grandparent raising a grandchild, a volunteer, an older adult still working, or one who is simply enjoying a well-deserved retirement, we need you to stay healthy and safe. I hope you all have a wonderful holiday season, and thank you again for welcoming us into your homes. And it is now my great pleasure to introduce Caroline Bain from the Pennsylvania Insurance Department. Thank you.
Thank you, Secretary Kavulich. And on behalf of Pennsylvania Insurance Commissioner Michael Humphreys, I want to thank Bucktown Center, the Department of Health, and the Department of Aging for organizing and hosting today's event. Good morning. I am Caroline Bain. I am the Policy Director for the Pennsylvania Insurance Department. Our message is simple. Cost shouldn't be an obstacle to any Pennsylvanian that wants a flu vaccine. Pennsylvanians should not forego the flu vaccine because they fear an unexpected charge. For insured Pennsylvanians, your health insurer must cover the full cost of certain recommended vaccines. If you go to an in-network provider, you will not have to pay anything, including a copay or deductible for the flu or COVID vaccine if you have comprehensive major medical, individual, or small group market health insurance, including coverage through Pennsylvania's official health coverage marketplace, Penny, insurance through your employer, Medicare or Medicare Advantage coverage, medical assistance or CHIP coverage, or coverage through the Pennsylvania Employees Benefit Trust Fund. Your insurance company or healthcare provider should be able to help you find a vaccination location that is in-network, and you can call your in-network provider ahead of time to make sure you will not be charged for either the vaccination or the office visit. PID understands that there's a lot of uncertainty right now when it comes to health insurance coverage. Whether it's the potential rise in health premiums or misinformation centered around paying out of pocket for health services that were once covered under a plan, we understand there's a lot of confusion. One thing we don't want consumers to be confused about, though, is immunization coverage. National trade groups representing insurers here and across the country have publicly stated that health plans will continue to cover recommended immunizations, including updated COVID and flu vaccines, at no cost to consumers through the end of 2026. PID expects Pennsylvania's insurers to continue to cover vaccines without cost sharing or the imposition of other administrative barriers consistent with the benefit plans approved for sale in 2025 and the promise of coverage that was made to the insured at the time the coverage was purchased. Lastly, please know that you have somebody on your side. If you have any questions or issues with your insurance company, policy, or agent, connect with us at pa.gov/insurance or pa.gov/consumer. PID is here to help. Now, I'm delighted to hand it over to Bucktown Center resident MJ Igo. Thank you.
Good morning, everyone. I'm one of the privileged individuals that was born at a time when vaccination was very, very important. And I had mentioned earlier that a young man I went to grade school with was a victim of polio, and his mom was my first grade teacher. And this young man wore a heavy iron brace all of his life, and that was a result of polio. From that point on in our lives, and this is in the 50s, we were always vaccinated. In my particular family, when vaccines became available, we were taken to the doctors and got the vaccines. I have a great niece who also works at the National Institute of Health, and she's a young woman, 30 years old, who completely says that the individuals that feel the vaccines don't work are the naysayers, and I'm one of the people that says, get a vaccine. We have no idea how many people we come in contact with that we may be carriers. I ended up with a respiratory problem. I have a COPD with chronic bronchitis, and I knew that I was definitely an at-risk individual with a compromised immune system. And, wash our hands went to great lengths to keep people aware of how frequently we touch things, but it also brought home that I need to be immunized against diseases that could possibly kill me. I don't see mumps anymore, and I don't see measles here in Pennsylvania. Chickenpox, rare, polio, rare, and they've been eradicated because of the vaccine programs that had gone on for many years. When I was younger, I definitely am an individual that, endorses vaccines, and when they refer to DePietro's Pharmacy, when Tommy DePietro came and his crew, I certainly got vaccinated right here and said thank you very much to Bucktown and to DePietro's Pharmacy. The other part of this is, as was explained earlier, we're going to be going in and out of each other's homes and family gatherings, and I wouldn't want to carry anything to an innocent child. I have a great nephew who's 3, a niece who's 2, and another one who's 6 months. And I wouldn't want to go into their home and bring something into them because they're very compromised at their young ages. And the other part of this is when we're around older people, and I'm a senior citizen, as they say, we have to be aware that people are compromised and to protect our health. I've been fortunate up to this point, as far as medications and inhalers, that I've, come this far and have not had serious complications. However, I do stay on task with my vaccinations, with diet, exercise. I do the best I can for my individual self, which is all that all of us can do is to practice good health for ourselves and for our communities. There are I want to say senior citizen centers other than our community room here, and many people there are going in and out of family homes and gatherings, and their families are not aware that their senior members of their families are not vaccinated. People are not checking on them to see, how well they are or how far they've come with their vaccination. So it's very, very important to pass the information on to each other in a community, whether it's through church groups, through a community center, or through any of our social environments that we all enjoy. Whether you're a bowler, a tennis player, pickleball, you go up to the Y to swim, we need to protect ourselves and our communities. Thank you very much.
Thank you so much for your experience and sharing what life was like before we had vaccines in our community. So anyway, we are thrilled to be here. Thank you so much for hosting this event with us, and we're happy to answer any questions you have. All right, if there are no questions, thank you so much for being here, and happy holidays, everyone.
It's my daughter's birthday today.
I'd like to kind of pass the torch here to Dr. Debra Bogen, the Pennsylvania Secretary of Health, to say more.
Great, thank you so much. Good morning and happy holidays. Thank you, Marty, for the introduction, and thank you to Secretary Kavulich and Director Boegen for being here with me, as well as MJ, who's going to be, who's one of the residents here. It's great to be at this really beautiful space at Bucktown Center. To start, I want to applaud the residents here. I heard a pharmacy and you all got vaccinated, so that's amazing. You're setting an amazing example for Pennsylvanians across the state. So the holiday season is here. As you have beautifully decked honor to invite Secretary of Aging Jason Kavulich to the podium to discuss the great work his agency is doing in this area.
Good morning, everyone. Before we get started, I have to, go with a full disclaimer that this, in fact, is not a Dunmore Bucks tie. As General Weigel would argue if she was here with us today, a proud Dunmore resident that she is. This is, in fact, a holiday tie, and thankfully Senator Flynn's office is here with us today to back me up on that. Being the two West Siders that we are, we want to make sure that we did not have that mistake made for our colleagues from the Pennsylvania Insurance Department. Thank you.
Thank you, Secretary Kavulich. And on behalf of Pennsylvania Insurance Commissioner Michael Humphreys, I want to thank Bucktown Center, the Department of Health, and the Department of Aging for organizing and hosting today's event. Good morning. I am Caroline Boehm. I am the Policy Director for the Pennsylvania Insurance Department. Our message is simple. Cost shouldn't be an obstacle for individual or small group market health insurance, including coverage through Pennsylvania's official health coverage marketplace, Penny, insurance through your employer, Medicare or Medicare Advantage coverage, medical assistance or CHIP coverage, or coverage through the Pennsylvania Employees Benefit Trust Fund. Your insurance company or healthcare provider should be able to help you find a vaccination location that is in-network, and you can call your in-network provider as to health insurance coverage. Whether it's the potential rise in health premiums or misinformation centered around paying out-of-pocket for health services that were once covered under a plan, we understand there's a lot of confusion. One thing we don't want consumers to be confused about, though, is immunization coverage.
Can you tell us why it's so important for people to get flu vaccine this time of year?
Yeah, I mean, there's no better form of healthcare than preventative healthcare. So it's something that I stress to my customers, giving them the education, empowering them with the education, letting them make their informed decision, having an administration that supports pharmacists to provide vaccines was priceless. As mentioned in the press conference early on a couple of months ago, it was a little rocky. Were we be able to give COVID vaccines? Were we not going to be able to give COVID vaccines? So having Governor Shapiro and his entire administration support safe and efficient vaccination for the community was very important. Being here today, seeing Jason, Secretary Kavulich. Secretary Kavulich was instrumental during COVID to build really a network of vaccine services for Lackawanna County. And now to see him do that on a statewide level, I know at the end of the day that the state of Pennsylvania is certainly getting the vaccination services they need because of Governor Shapiro and because of people like Secretary Kavulich. So that's reassuring, not only as a pharmacist, but as a member of the community.
What's one thing you tell people when you come in and they're a little hesitant? Should I get it? Should I not?
I mean, the way I convey it is I try to get personal with them, right? So like, where do you live? Where do you work? Who are you around? Most likely, once we encounter and overcome those questions, I live in a high rise, or I work at a senior center, or I babysit my grandson. You could always, so maybe the individual might not want to get vaccinated for their own choice, but once you could connect it to another person, another individual, that usually makes sense to them, right? So maybe they don't want to get vaccinated, but once they realize that, oh my goodness, I should get vaccinated because I babysit my grandson and I want to get vaccinated for him, when you could connect the dots for the patient, give them the education behind it, and just, talk about the risks and the benefits, most people roll up their sleeves and get vaccinated.
Thank you for being here. Just wanted you to reiterate why it's so important that people get their vaccines and the respiratory viruses.
Well, what I have had experience in my lifetime is that we've eradicated, for the most part, measles, mumps, polio, chickenpox, rubella, and that's as a result of people being vaccinated. And I'm of a generation where vaccination was very important. Going to grade school with a young man who wore an iron brace as a result of having polio. It is a constant reminder to me how important vaccines are, and that we can have a healthier community, a healthier world, in fact, if we continue to vaccinate. I am all in favor of vaccinations.
So what would you tell somebody from the younger generation who maybe isn't so sure that vaccines are worthwhile?
I would tell them that they got to where they are because they had parents who made sure they were vaccinated, and that they should do the same for their children to get their children vaccinated.
And how does that help to protect others that they come in contact with?
Well, if people are not aware of it, that we could be carriers, and we need to protect those in our family that may be more vulnerable than we are. I consider myself vulnerable, and I take the steps to ensure I'm vaccinated, and I do have younger nieces and nephews who are like 6 months, 2 years, 3 years. We don't have any seniors in my family other than myself, so I want to lead and remind them how important it is to vaccinate their children. And as I said, my great niece works at NIH, and she worked with Dr. Fauci as well, and I'm a strong proponent, again, of looking into it. If you've had a negative reaction, speak to your doctor. Ask them if there's an alternative, or is there something else that you can do to prevent yourself from possibly contracting a life-threatening disease or a disease that may take your life.